full agenda. Thank you so much, Lindsay. And I don't want to delay. So again, welcome. We are having a special session. So this is not our typical day. We are meeting on a different Friday. We will be recording today's session, today's workshop, and adding it to our YouTube channel. Live transcript is available as well. So at the bottom of your screen, if you would like to go ahead and initiate closed captioning, please do. And again, as you are coming into the room, if you would let us know who you are, where you're joining from, and what are you reading, or who's your favorite author or your favorite book. I am Naomi Williams. I am joining you from what's known as Muskogee Land, now known as Augusta, Georgia. And I have several books that I'm reading right now, but one of the ones I'm about to go back to is called The Big Leap. Just for those who may not be familiar with PFCC Partners, just wanting to let you know who we are, our mission and our values. So we, excuse me, we are working and looking at centering the inclusive human experience of health. We believe in reinvent through radical collaboration, as well as being a catalyst for system transformation. We know that the healthcare system is made up of a lot of people, and it's a very complex system that spends a lot of money. Here at PFCC Partners, we're working to transform that system to where it is beneficial to all parties that are involved, and leveraging and bringing in people with lived experiences voice, making sure that we are a part of every part of our healthcare decision making from beginning to the end. So with that, from PFCC Partners, slow down, Naomi. Here at PFCC Partners, we believe in collaboration and creating that network. And the way that we create and open that space has also been through our PFA network, which was developed by patients and family members for patient and family members. I believe, Lindsay, if you are available to drop the link of the PFA network into the chat. This is an opportunity for patients, family members, advisors, partners to create and fill a space, whether that's with engagement opportunities, skill building, as well as with communities and through community forums. PFCC Partners, we are working on a collaborative project, and we are so proud to be a part of the Inspire Project. It's a national project working to advance partnerships between healthcare organizations and people with lived experience. If you work in a healthcare organization and care about better and more equitable care, please take a moment to complete the survey. It should take no more than 10 minutes to complete. Your responses and experience will be an important addition to the work that we're doing. You can use the QR code that is here, and we can also drop the actual link to the survey in the chat. I think I went through that rather quickly, but want to make sure that our presenters today have more than enough time to not only share their information, but to also field questions from you all. I do believe, I know we have a mixed group of people who are joining us, whether that's individuals with lived experience, patient, family member, partners, executives, so on and so forth. We want to make sure that we create this space for our health care administrators to have a space to learn and share as well. So without further ado, I am happy to introduce this month's workshop, Measuring What Matters, Measuring Community Engagement, presented by Ayadola Anishe, Asia Williams, and let me move this because I can't see your last name. Merritt Felzine. So without further ado, I will pass it over to Ayadola, Asia, and Merritt.
Thank you. Good morning or good afternoon, depending on where you are dialing in from. And happy Friday. Before we get started, we just want to give a huge shout out and thanks to PFCC partners who have always recognized the work that we are doing at the National Academy of Medicine and for giving us this platform to be able to share it with you. So Libby, Naomi, Lindsay, and the rest of the team, thank you. While we are kind of bringing up our slides, I will continue our thank you tour. And so we have to also thank the Robert Wood Johnson Foundation, who has funded this work for the past 4 years, recognizing the importance and the value of it, as well as the California Healthcare Foundation. And myself, Merritt, and Asia are just excited to talk to you about what we believe is hard work, but what we also believe is heart work. You can go to the next slide. So we want to acknowledge that the National Academies, which is the group that is leading this work, gathers on the traditional land of the Piscataway people and the Anacostans, past and present. I want to honor with gratitude the lands and the people who have stewarded them for generations, but I also want to acknowledge the conflicting feelings that are associated with occupying this land and the history associated with it. And so we encourage everyone to go to native-land.ca to see the land that you are currently living and working on. Next slide. So I've mentioned that we are with the National Academy of Medicine, and specifically we are with the Leadership Consortium for a Learning Health System. I'm going to continue on because you will have access to these slides and you can read all about the National Academy of Medicine Leadership Consortium on your own. Next slide. Yep. We want to make sure that our conversation today is just that, a conversation. And so our hope is to make this as interactive as possible. And so we're going to be going through things at a rather fast clip. And so we encourage you to go back to a webinar that we did for PFCC partners back in July 2022, where we actually went through all of the materials and we spent a lot of time on each of the resources that we're going to touch on today. But because we want to make this interactive and meaningful, we encourage you to use the chat. And because of that, I originally grew up in Pittsburgh, but today I'm going to pretend like I'm from New York and I'm going to talk a little bit faster. Next slide, please. So we understand that there are many groups that are doing community engagement. They understand whether it's organizations, alliances, collaborations, they understand the meaning of it. Next slide. But where there seems to be a major gap is really in understanding how to understand the impact of engagement. What is the impact of engagement that's happening, and what is how is it being useful? How is it resulting in change? And so we understood that there was a need to fill this gap. And so we needed strategies and resources. And that's where the work of the National Academy of Medicine comes in. Next slide, please. So we believe that the fundamental question for our work is not whether the range of entities that are doing or engaging communities feel like they are doing it, but whether the communities themselves feel engaged. And so we wanted to address the gap that exists in terms of how we define meaningful community engagement and the gap in how we assess its impact. And so for our work, our goal was to build a menu of effective and evidence-based community engaged indicators and metrics that could be used to measure meaningful engagement. Next slide. On this slide, you see a whole range of potential audiences that could use this. I will sum this up by saying that ultimately we hope that anyone who touches health and healthcare, even if it's tangentially, that you should be looking at working with communities, engaging with communities, and measuring the engagement and the impact that's taking place. And so whether you are in a hospital or health system, or you're in housing and transportation or education, we believe that these resources are going to be useful and meaningful to you. We have a next slide, please. We have a 34-member organizing committee that has been guiding this work. And so here you see their smiling faces. And so we have people who represent human-centered designers, community leaders, researchers, policy experts from diverse backgrounds. And I actually want to highlight that we have 17 community leaders who are guiding this work along with us. And at the bottom right-hand corner, there is an empty space that's right there. And we say that we have left this space for your picture. Anyone who is joining us on this journey of measuring meaningful community engagement becomes an honorary member of our organizing committee. So we left the space for you. Next slide. We recognize that how we define things is really important. And so when we're talking about community engagement and meaningful community engagement, I just want to highlight a couple of things. We are using community engagement, but that could also be equivalent to consumer engagement, patient engagement, civic engagement, stakeholder engagement. And we recognize that community engagement is complex, and it has different considerations for how communities are engaged, when they are engaged, and how communities themselves want to be engaged. But one of the things that we ultimately believe is that meaningful community engagement requires changes and tectonic shifts in how we mobilize resources, how we influence systems, and how we build and sustain relationships with partners. And so in order to get to policy change, programmatic change, or practice changes that really serve the community, we have to be engaging with those who have the lived and living experience. Next slide. We have grounded our work in several foundational foundational standards. And you see them on the slide. Again, these slides will be made available for you so you can actually take a closer look. But I will just say that as a foundation for our work, we have focused on several standards to make sure that the work that we are doing reflects how we want others to use it and think about this work as well. Next slide. So as part of this work, we have generated 3 major resources that we're going to be talking to you about today. And so one of them is the conceptual model, which I hope that many of you have seen because it's been, I think we released it in February of 2021. And so we've just been super excited about that. But we're going to quickly review it. But what we want to do today is spend most of our time talking about the impact stories and the assessment instruments and how to use these 3 resources together. And so we want to have some dialogue and conversation with you around how you might be thinking about using it, any questions that might come up and challenges that you're facing, so that we can have this be a really interactive conversation. So that's why we're going to go through each of these resources pretty quickly. In case you are wondering and you haven't necessarily had a chance to review these resources, we have a website that actually provides you with all the information that you need on the conceptual model, on the impact stories, and the assessment instruments. So it provides a little bit of background and really just shares with you what is available. We also have a guide to using these resources because we believed that it wasn't enough for us to just share the resources with the public, but we needed to provide some initial thoughts on how you can use this, recognizing that there are a range of ways that these resources might be used, but we wanted to just provide some seeds for you all. And then we are working on a National Academy of Medicine special publication. And for all of my academics out there and people who really just want to understand the how and why of what we did, that special publication is going to have all of that in there. And so we're hoping to release that probably sometime next year. So stay tuned. Next slide, please. We learned a lot along the way. And I wish we had time to share all the lessons with you. But if you are particularly curious, please ask us a question during the Q&A and we can talk a lot more about what we've learned. But I will just say that we had to make a lot of changes, in the way that we did things, in the way that the National Academy of Medicine Leadership Consortium reached out to and connected with people. Our timeline and resources shifted. And so we have a lot of examples that we've learned that we can share with you about how to actually make sure that the work that we were doing was meaningfully engaged, not just providing information to others on how to do it. We wanted to walk the walk and talk the talk. And so if you're interested, like I said, please feel free to ask us a question about that. In the interest of time, I'm going to jump to the conceptual model and start to talk with you a little bit about what this model is for and how it can be used. Next slide. So the organizing committee felt really strongly about there being a need to reinforce existing conceptual models, but we also recognized that there was a gap in terms of the models that did exist. And so we wanted to develop a model that took into consideration particularly outcomes of engagement, that emphasized health equity, and that also talked about health system transformation. And so because we saw that that was a gap, we wanted to fill that gap. Again, this model is meant to add to what is already in existence. It's supposed to be complementary, and it's supposed to be a living, breathing one, because we recognize that over time, things will need to be added to it, things will need to shift and change. But ultimately, we didn't want to produce something that was duplicative, and we just wanted to add and reinforce existing conceptual models. Next slide. Here you see the various prototypes. And so this model was a work in progress, and we had a lot of conversations in order to get to the final model. And we just wanted to put this slide up so that you all could join in with us on the stages. But I'm not going to spend too much time on this. Next slide. So I'm going to walk you through the conceptual model. We start with a central focus on community engagement. Next slide. And then we built on that central concept of community engagement by adding core principles. We believe that these core principles are essential to really ensure that community engagement is taking place. And so those are trust, bidirectional, inclusive, culturally centered, equitably financed, and you can see the rest here. Next slide. We added to the central focus of community engagement and those core principles by identifying 4 domains of strengthened partnerships and alliances, expanded knowledge, improved health and healthcare programs and policies, and thriving communities. If you are a gardener, we ask you and invite you to consider these 4 areas as petals. If you're more on the engineering and technical side, feel free to think of these as propellers. But ultimately, when you have community engagement, when you engage communities with these core principles in mind, then we believe that you can get to outcomes that are associated with these 4 areas. And under each of the 4 areas, we have indicators that go a little bit deeper into explaining some of the things that you should be able to measure and some of the important outcomes to consider when you're thinking about measuring engagement. So for example, under strengthened partnerships and alliances, we would hope to see trust and shared power. Under improved health and healthcare policies and programs, we would hope to see that solutions are community aligned and that they are actionable, implementable, and recognized solutions that are in use. Next slide. We recognize that then when you have community engagement, you focus on core principles, you have these outcomes that we can get to this main goal of health equity through transformed systems for health. At the same time, we recognize that there are a whole host of drivers of change in health and healthcare and social, political, racial, economic, historical, and environmental context that's taking place. And we do believe that these things can actually be changed, right? And so we can feed into the system when we, as a whole, the health ecosystem is centering engagement, focusing on these core principles, looking at these outcomes, that we also have the ability to change what drives health, to change the drivers of change in health and healthcare and change the context that we live in. Next slide. We wanted to make sure that we had a model that was dynamic, flexible, and that would allow stakeholders to focus on what matters most to them, and that they're able to do so in partnership and engagement, and the role that engagement plays in these efforts. And so this is the conceptual model that we were able to develop. I want to go to the next slide before turning it over to my colleagues, because as we were developing the conceptual model, we also wanted to take a look at ways in which the conceptual model can be used. And so we hope that this model helps to spark a conversation and create a shared language on community engagement as it relates to the work that you all are doing, the vision that you have for your partnerships and engagement. That the core principles from the conceptual model can be used to identify what matters most, and that engagement practices can align with those principles, and that you can identify then what the goals and outcomes are that would underpin the engagement that's taking place. We also believe that the conceptual model can be used and adapted to meet community engagement needs, right? That it's an opportunity to identify the domains and indicators that are most important to assess and the impact of your engagement. And then we hope that people will connect the conceptual model to the impact stories and the assessment instruments, which we're going to talk about in a moment. But what I want to leave you with when we're talking about the conceptual model is this notion that all models are wrong, but some are useful. And so we hope that audiences will make the most out of this model and make it useful for them. And so what does that mean? It means understanding that language is important and taking the time to sit down with your with the folks that you are engaging to understand what is meant by trust, what is meant by co-equal. I saw somebody said, well, what do you mean by co-equal? We can have a conversation about that, but it's really, what does your community think about, and how do they define it? And then also recognizing that we have 10 principles here and 19 indicators. Our hope is not that everybody tries to adhere to all 10 principles and tries to measure all 19 indicators. Pick two or three of the principles, pick 2 or 3 of the indicators, and start to look at and measure the engagement that's taking place. This model is yours to do with it what your communities need for it to do. It's not a static model, it's a living, breathing model. So I want to now turn to Merritt, who's going to talk about the impact stories and make the connection for how to use the conceptual model with the impact stories. So thanks, and Merritt, handing it over to you.
All right, thanks, Ayadola. That was really great. You get faster and faster at it each time. I'm Merritt Felzine. I was one of the community members who got to participate in this amazing project over this period of time. And I'm in Northeastern Colorado and have worked in engaged research for quite some time. And so as reflected in the model, we know that community engagement is complex, it's dynamic, and that it changes across context, it changes across time and location and project, right? And so next slide, Asia. So the organizing committee saw this importance of how real stories, so in developing the model, we were telling real stories of community engagement. And so how could real stories of community engagement be included into the work that was being undertaken? And so we're hopeful that the stories that we're going to share with you today, and we're just going to quickly show you one, kind of the overview of what we chose, and then a brief peek into one, that these will demonstrate different approaches to engagement, how no two processes look alike, how engagement is dynamic, it can be messy, how engagement can be evaluated, and how it can lead to improved outcomes when it is done meaningfully. Next slide. So the information on these different stories is kind of about their development, and we presented a lot of this at the last presentation, and so I'm not gonna go into them terribly deeply. Next slide. But I will say that we ultimately identified 7 stories that we felt like represented different locations and communities and health topics. They demonstrated different starting points, engagement processes, and outcomes. And that these stories are summaries that have been produced so that they can be, accessed really quickly and kind of read at a, sort of a single sitting. They're a small subset of the stories that are out there, but at least this is something to start with. And just as a reminder, remember, these are real examples. And while sort of models are never perfect, but are a starting place, so are these stories. They're never perfect, but they're perfectly imperfect. And we hope that you all might see a bit of a real journey in each of them, maybe a real piece of your own journey in each of them somewhere. And I don't know if we want to put a link to the stories themselves right in the chat, but we could do that. So Asia, if you'll go to the next slide. This is an example of a project that I was involved in. This says just an at-a-glance example of what we called It Matters. And yes, there's supposed to be 3 T's in there. And this was about medical assisted treatment for opioid addiction in a rural community. What's included on this particular page, which you can't see what's underneath it, is a quick overview of the It Matters effort, the key components that were shared with this story, and the key engagement activities, including the project outcomes. So just briefly, this particular story is an illustration of a long-standing community research partnership that successfully built a multi-level opioid awareness campaign and treatment infrastructure in rural Colorado, where we didn't have any treatment, so to speak. The impact story includes, as I said, the background of this work, the engagement activities, and the outcomes. And it also then overlays this story on top of the conceptual model, which, if you will go to the next slide, Asia, starts to show how this particular example fits this model. So as I said, every engagement process is unique. There are different starting points, different levels, different strengths, different outcomes, different goals. But for It Matters, what we were able to identify is the major engagement principles for us, for this project, are highlighted in green, which I'm going to pull this up. So it's not all of them. And I think that's really, really important for everybody to understand. It's like not every project's going to be achieving everything. We were able to say, hey, these are the few things that we really want to focus on in this project. And by focusing on those 4 principles, then we are also able to map the work to the actions within the domains. And so through a trusting relationship and a long partnership, could we move towards the goal of a culturally centered message that was co-created and co-equal? We found that our outcomes included a strengthened partnership and mutual value of our rural values. We found that we managed to achieve expanded knowledge using new tools and community-ready information. And this was community-aligned solutions and increased capacity. So what this tool did for us was solidify our outcomes. Yes, our outcomes were intended to be sort of meet the goals, collect the data, achieve, sort of the aims of the project, right? But what the model did for us was a much more nuanced explanation of the outcomes that really happened. It provided us a much deeper understanding of how we got to where we got, and perhaps maybe some things we missed along the way, maybe some lessons and some opportunities, but that allows us to build on this work as we move forward. Next slide. So that was super brief. So we encourage you to review these impact stories, listen to them, reflect on these stories and this type of work and how it might resemble your own. What did the storytellers do to engage? What were their lessons? What did they learn along the way? Think about what you can pull from these. What what about these stories might you want to share in your own engagement process and hope for in your own outcomes? Who might you share them with? How might you map these stories and your work to the conceptual model? And it's sort of a teaser as to where we're going with this. How might you use some assessment instruments that are also part of this whole project, help you measure and ensure that the movement that you're hoping for is actually being achieved? Next slide. So we're going to take just a quick pause right there and invite you to ask any questions on anything that we've presented thus far. A leading question might be, is there some way that you see yourself using this story, these stories, or these impact stories, or even the model? Or what questions do you have for us? We'll take a few minutes and just open it up. And I'm not letting everybody look at chat.
One of the questions that came in was about defining co-equal.
Mm-hmm.
Yeah,
I started to address that.
yeah. So I'll give some initial thoughts, and then maybe Merritt, you can talk about how you all defined it for your work with It Matters. So as we were, thinking about the conceptual model, it was important for us to recognize that oftentimes there's an imbalance of power within the relationships that take place. And so we wanted to address that by saying that the aim is to ensure that these relationships, these partnerships, these collaborations are co-equal. And recognizing that oftentimes that doesn't mean that things are 50-50, right? But that what we are suggesting is that groups should sit down with their community partners, their community leaders, and whoever they are engaging, and talk about what is the role that you want to take on? What is the role that we're going to take on? How are we going to work together? And in that way, you're able to get to co-equal because you all have identified what you want to do, what role each of you will have, and can then come back to adhering to that. And so it isn't that, everybody within, for example, if we're talking about the research context, it's not that everybody on the research team, including patient partners, should be, helping to write the proposal unless they want to, right? Unless that is something that is important to them. Not everybody needs to have, the IRB certifications unless they want to. And so really just having open conversations about what is the need for the work and the role that everybody's going to play in it, and then adhering to that. That's how we got to co-equal.
I would just add to that. Thank you, Idola. That was perfect. The only thing I would add to that is this idea of expertise, and that everybody brings expertise to the table. And so in our situation, it's recognizing what this expertise is. And so our research partners didn't know much about how to disseminate information and to sort of create a vibe going on in northeastern Colorado or eastern Colorado for that matter. But our community partners completely knew how to create that. They knew how to network. They knew how to message. They knew where to take the messaging. And so that's just one simple way of saying, in this situation, others at the table had more expertise about something than the other set at the table. And so for us, it's always about this expertise. And the expertise, everybody carries a lot of expert hats, but we're always good about saying, this is something that I do know well, but that's something that I don't. And I trust you to move forward on that, but you trust me to also guide the project on this other side.
And then I see another question here about how did we sequence our activities? Did we do the conceptual model? Did you have the conceptual model developed before the community engagement project began, or was it underway while you were developing the conceptual model? So great question. I can start off and let my colleagues add to it. So We started this project in 2019, and all we had was this goal of identify measures and metrics. So we needed to come up with a process. We needed to come up with, how we were going to do that. So we had a steering committee that included about 15 people, 4 of whom were community leaders. But we recognized that, one, there was this gap of models because we actually looked at what conceptual models frameworks existed for measuring community engagement. While we identified about 20 plus models, very few of them focused on equity. Very few of them were things that could be used across the health ecosystem. So many of the models that we saw that we really liked were central to community-based participatory research or patient-centered outcomes research, but wouldn't necessarily be, completely relevant or applicable to policymakers or health system representatives. So we wanted a model that was going to be more inclusive. We approached the model from a what is best standpoint, not what measures already exist in the literature, but what should be measured. And so we worked with our organizing committee, which then was augmented with, I think, at that time, 11 more community leaders, Merritt being one of them, so that we could then get a better sense of, from the community perspective, what does meaningful community engagement look like, and what are the outcomes that you would see if it's taking place. And so the conceptual model was then born out of that. When we got to the impact stories, and Merritt, do you want to talk about the process for kind of how we got to the 7?
Yeah, so really part about the impact stories were used kind of on the backside to help to inform the work that was, that was being done in order to come up with the model. But then there was this aha, the stories were so powerful. How do we really capture the stories? There's such a good illustration. So there were a lot of stories and we couldn't share them all. It was onerous. And we had to really figure out, how do we capture just some models, some sort of good examples. And so we pulled together a subgroup of people, including, staff and community members, and we systematically analyzed and discussed and evaluated and used check boxes and extraordinary categorization skills in order to sort of say, these are the ones that rise to the top. These check all the boxes to the best of their ability. And then we worked equally hard in figuring out how to tell the story. How do we share the impact stories on the website so that they are easily accessible? And so the amount of effort that went behind this simple list of 7 stories is extraordinary. Yeah.
So keep your questions coming in the chat. We will try to answer them, but we also want to move on to talk a little bit more about the assessment instruments and how those are tied to the conceptual model. So we're going to turn it over to Asia, who's going to walk us through the assessment instruments.
Thank you, Ayadola and Merritt, for those wonderful overviews. Continuing, really echoing Ayadola's thank you tour. It's really great to be here and continue to get to share this story that I'm so proud to be a part of. But like Ayadola mentioned, the last resource in our suite are our assessment instruments. So our assessment instruments contain the community engaged and evidence-based questions or question sets that have been crosswalked back to the conceptual model, similar to how the impact stories were. So there are 28 assessment instruments, and together they cover all domains and indicators of the conceptual model. So if you are interested in measuring bidirectional learning or trust or shared power, really any other element, you have the options ready to discuss with your community partners and implement. So the next few slides actually share details from a really rigorous search process to narrow down the relevant literature and land on our 28 assessment instruments. I will spare you the details of this review that resulted in our team reading over 1,000 articles, but you can hear more about this specific process in our previous workshop presentation from last year. I did, however, want to share one hallmark of our process to get to that 28. And that was that in discussing the different kind of criteria out there that we can implement with the organizing committee that would help us get to a smaller, more manageable subset of assessment instruments that we could eventually crosswalk back to the model. We ultimately decided to prioritize instruments that first engaged communities in their development, evaluation, or implementation, and second underwent some kind of psychometric property testing. So we focused on validity and or reliability testing. So this step was just really crucial to emphasize the importance of ensuring the active presence of communities in measure development, and also help create kind of a bridge between community engagement and scientific rigor. So from here, we also worked with our organizing committee members to develop summaries for the instruments to help find the best ways to report information from the literature that the committee felt were important for audiences to know in deciding what instruments would work best for them. So I'm actually now going to switch over to our website to just talk through how someone might pick those relevant instruments and questions. If I can just get my Zoom tools working. 1 second. Okay. Here we are. Okay, so like Ayadola had mentioned, thanks for the thumbs up, Merritt. Wasn't sure if you could see what I see. But like Ayadola mentioned, each resource has a dedicated webpage sharing the purpose and some details around navigating the resources. I believe Lindsay shared the link to view the Impact Stories resource page, and here's the resource page specifically for the assessment instruments. So if you scroll down, you will see the instruments organized first by instrument name in alphabetical order. Instruments that cover the most conceptual model domains, well, all of the conceptual model domains, I should say, and the most indicators. Instruments organized by how they align to each domain, the place each instrument was used, available language translations, and then psychometric properties. So say you are a part of a group operating out of a health system and are interested in understanding and improving your relationships with the surrounding community you serve. So you could click on place and drop down all the way down to the hospital, clinic, or health system setting to find an assessment instrument used in a similar setting to yours. So if we go to, for example, the participant questionnaire for the public and patient engagement evaluation tool summary. So here you will find, well, first you'll find some articles from our literature review that we pulled information from. And if you want to take a deeper dive, you can, but we do share an overview of the assessment instrument at the top, and also some key features on the left corner, including community and geography, the key community engagement outcomes, places of the instrument use, language translations, and so on. And front and center, we have, again, our model, which shares the exact crosswalk results between the model and the assessment instrument questions. So in clicking on this model, you might be interested in first questions that align with, like I said, trust or shared power to start out with. So you would click out and scroll all the way down to this table. So each summary has this table which shows the model domains and indicators on the left column, and then the indicators on the right, or the questions that align with those domains and indicators. So if you scroll down to trust and shared power, you'll see those questions that aligned. So for shared power, you see questions that we thought aligned included: I was able to express my views freely. I felt that my views were heard. I had enough information to contribute to the topic being discussed. So from here, you could take these questions, discuss them with your partners, and tweak them, of course, to modify your unique context. You could also scroll down to the other parts of the summary to learn more about how the instrument was developed and used, how communities were engaged in developing, implementing, or evaluating the instrument, just so you can get some inspiration. Okay, so now I'll go back to the slide deck. Oh, okay. Oh, and of course it went all the way to the beginning. Apologies for the whiplash you might be getting as I go all the way back to the assessment instruments. All right, so well, basically the slide just summarizes all the initial guidance that I shared when scrolling through the assessment instruments summary. So with these assessment instruments, we really encourage you to look at those high-level details, the instrument overview, those key features, to see what community situations align with yours. We ask you to look at the questions and the summaries that align, and discuss which of those questions align with the goals of your partnership and the areas on which you are working, and then make modifications as needed. One last bit that we also ask you to do is, adapt the conceptual model to really visually identify what you're measuring, because like my colleagues have mentioned, you don't have to, the goal is not to look at all the indicators at once. You have to start somewhere and just really narrow down to the ones that matter most to you now, and then go from there. And we also have many insights to share from the data we collected on our assessment instruments. And I won't share all those now. You could definitely go to the previous presentation to find that information. But I will share one data point that we find really interesting, which is that of all the measurement questions, almost 80% of them we felt aligned to strengthen partnerships and alliances. And this really just emphasized the importance of, that relationship building, and that it is continuous throughout. So, that's a really important point to us. Okay, so I'm going to take a breath. Hopefully I didn't go too fast, but definitely want to take a step back, like we did with the impact stories, to hear questions about connecting the model to the instruments, maybe how you would use different, oh, I already see hands up, great. Erin?
Hi, yes, thank you. I've got your website up, and I appreciate you pulling up that example under the location and looking at healthcare. That's where my focus is measuring family advisors interacting with the healthcare organization. And do you recommend looking in other areas as well on your website here? Like, I love that example of going by location, but should I be browsing through all of the drop downs as well?
Yes, we definitely recommend that. And while we have them organized initially by the places provided in the literature, we do find that you'll find that really the instruments can be transferable to different settings. So another reason to kind of step outside of that bucket and see what else is out there.
And one follow-up question, do you recommend, sorry if it's just, I'm still just trying to wrap my head around this. Do you recommend, so you have all of these questions and you recommend taking what's applicable or we find applicable to our certain situations, adapting the questions if necessary, and then reviewing the results. And if like you do it from like agree to disagree, if you get strongly agree for all of these that are related to trust, then that's how you're measuring trust.
Mhm. Yeah, so I will say with these crosswalk results, definitely a lot of work went into really looking at the context the article provided. I believe that we have like 44 hours documented of having these conversations. So, we do feel this is a good starting point, but there is a chance, and we actually, encourage these types of conversations with your partners, that you might find that a question that we've mapped to trust could also align somewhere else. So it really is about having that continuous conversation with the information given. Mhm.
Thank you.
Thank you.
And so if anybody else has a question, please raise your hand. And in the interim, one of the questions that came up in the chat was, this is from Edeline. I work in continuing education. Do you see this model as something that can be adopted to engage people with lived experience and community engagement? Merritt, do you want to maybe start with that question?
So the simple answer is yes, why not? Somewhere along the way is sort of like engagement is engagement and good engagement is good engagement. And so whether it's people with lived experience or a group that's very diverse for lots of different reasons, the point is that we're trying to go back to really good sound engagement principles. And so if we can start at the principles and think about the domains and the impacts, but along the way start to answer these questions around are we doing what we think we're doing, which really is how I see the assessment questions, is really that question of I think I'm reaching out. I think I'm developing trust. I think we have this type of co-equal relationship going on, but do we really know? And so that's what I love about these assessment questions, is that ability to start to ask those questions in a much more meaningful and impactful way that's not so research heavy that it's burdensome, but actually pretty darn practical, which for me is really what I'm looking for. And so I'm sorry that that's not specific to people with lived experience, but I hope that globalization and level setting around engagement principles are good. Good ones are always good ones. And let's make them better.
And I would just add that, as we like, everybody who is touching health and healthcare in some way should be doing engagement. And whether that is having a collaborative, a partnership, or engaging those with lived and living experience, right? We are just being broad and calling it community engagement, but we recognize that there are many different things that you could call it, including engaging people with lived experience. One question from Harv is, are there any use of AI in research? And so in the processes that we used to develop these 3 resources, we did not use AI. That said, I think that you bring up a really important question as we see a proliferation of artificial intelligence and machine learning in all aspects of health and healthcare. How are we communicating this to patients? How are patients and the community engaged in the development of these resources and these AI tools and machine learning? And so I think that that's a broader question, and that these resources hopefully will be used by those who are trying to develop, evaluate, and implement AI as well. And then another question that I see here is there information on the site about how to cite or acknowledge the instrument sources if they were to be used in our own assessments? Asia, do you want to take that question?
Yes. For that specific assessment instrument, I believe actually there should be you could just cite the web page where the assessment instrument is on. We do have all the literature review articles that are shared at the top. All of those articles are either open to the public, or we did request or work with publishers to purchase and make that information publicly available, recognizing that not everyone has access to the same journals and sources. So you should be able to just cite the web page that the assessment instrument is on.
Thank you, Asia.
Mm-hmm.
So the last question that I think we're going to take before we try to wrap things up is from Beth. And Beth asks, do you have materials to share with people in the community delivering and receiving healthcare to help them engage in the process? This is such a great question. You know, the process of engagement it's a messy one, and I think to what you're alluding to is that it also needs to be bi-directional. It can't just be the health and healthcare system or researchers reaching out to patients or the community or those with lived experience. It's also an opportunity for patients, those with lived experience, to be able to reach out to and connect with researchers, with academics, with the hospital and healthcare system, to be a part of the process and to advocate for a need for community engagement. I will say that our work didn't explicitly focus on the process of engagement. What we wanted to do was recognize that there are so many other people who have been working on the process of community engagement, but we wanted to elevate the need to actually measure that engagement. That said, maybe Asia, you can drop in the chat. We did pull together resources that were available that other groups have put together on the process of engagement, ways to engage, whether it's in the health and healthcare system or research, and it may have some information on how communities or those delivering or receiving healthcare could be engaged in the process. So we hope those are helpful. I am going to close us out. Asia, maybe if you can go to the next slide. So at the National Academy of Medicine, we live by this quote by Goethe, which says, "Knowing is not enough, we must apply. Willing is not enough, we must do." And so our call to action to all of you who are on this call, to you who are going to be sharing these resources with those that are in your networks, is to start somewhere. Start to measure engagement. Start to learn from it. Think about how it can be used to improve your processes, on how you are doing engagement and measuring engagement. We recognize that this is certainly a process, right? There's no kind of end result. There's no final destination. It's a continuous process. And we just ask that you engage. And that we hope that these resources will be a catalyst for, a way to get to meaningful community engagement that will rapidly shape and change the world that we live in, so that we can get to health equity through systems that are transformed. Thank you all so much for joining us on this webinar today. We hope that you have access to these resources. We at the NAM, Asia at the NAM, will continue to be a resource, and we are happy to answer any additional questions you have if you want to reach out to us. Naomi, back to you.
Thank you so much, Ayadola, Merritt, and Asia. What a robust conversation in such a short amount of time. Thank you so much for the resources. I don't know if my screen is sharing or not. I don't know what's happening right now. It's Friday. Oh, thank you. Thank you everyone for joining us. Again, as mentioned, the slides will be available. This recording will be available. The chat will clean it up and send that out with all the resources that are in there as well. And with that, have a wonderful and a safe holiday. We will see you again on December 2nd for our final community of practice for the year. Have a great weekend. Thank you so much.